you need addressed, feel free to input them in the chat box, but unfortunately I won't be able to read out all of them, but we will try our very best to incorporate them as they will lead us in the discussion. And so without wasting much of your time, I will give a brief round of introductions of our keynote speakers as well as our adolescent speakers for today's session. So for our keynote speakers, we've got Kiara from World Health Organization. She's the technical officer in the Department of Mental Health and Substance Abuse in Switzerland. And we also have Joanna from UNICEF. She's the adolescent health specialist in the newborn adolescent health unit from the United States of America. And for our adolescent speakers, we've got Bhumika, who's 15 years of age in India, who's a student. And we've got Omar, who's 19 years of age and who resides in Turkey, who is a member of the Civil Life Association. Without taking much of your time, I will give this time over to Joanna or Kiara to give us a video. Over to you.
Adolescents and young people all around the world are going through a critical time in their lives, growing, developing, finding their place in the world, and most importantly, setting the foundation for later life health and well-being. I'm just Simon, and I want to talk to you about adolescent mental health, supportive environments, and family confinement, communities help us to maintain good mental health. However, this can be a time of vulnerability with the onset of mental health troubles.
I believe that there is an urgent need to address now we have to remember our roots and accept who we are. It is often seen among our age that they're ashamed to be cousins. It may be intervention process, and we have to do to make a real difference. Energy, expertise, and funds must be invested to ensure that our young people can enjoy good mental health, despite the difficulties that they have faced. So, what investments are they making to improve their lives?
Thank you so much for that video. I'm not sure if I was the only one who was experiencing technical glitches, but I'm sure we'll be able to share with you the link to the video for you to see it all. So in the meantime, we'll have a keynote presentation highlighting the key findings from the recent issues around adolescent mental health and COVID-19, as well as guidelines from Kiara and Joanna. Over to you.
Kiara, are you on mute?
We can't hear you. I'm not
Kiara's
sure if you're mute. Joanna?
Sure. I think, I'm not sure if Kiara's on or did she momentarily?
Yeah, maybe she's experiencing technical glitches. Maybe we can have something from you.
Yeah, I'm happy to, Mimi, if you think I can do the first slide for Kiara while we're waiting for her to come.
Definitely. Okay, great.
Yeah.
So great. Sorry for that technical glitch, everybody. I think PMNCH and WHO, along with some other partners, including UNICEF and other, UN agencies, you can see here, last year, sometime around last year, we created a knowledge summary, which basically just means we put together, what's in the literature, what's in the evidence of trying to summarize the key issue of mental health among adolescents. And the problem really, as highlighted in the summary, which you can access online, is that about 10 to 20% of adolescents experience some kind of mental health condition. Among those, depression is one of the leading causes of illness and disability among adolescents, and also that suicide is one of the third leading causes of death for this age group. And, when we talk about the long-term impact of, mental health has on all of us, we know that mental health is not just something we experience right now, but it can affect, our functionality, the way we interact with other people, our ability to study, our ability to learn. And so it has longer term impacts on us, in terms of health, but also socioeconomically. And in terms of missed opportunities, we know that, seeing in the statistic, that a good number of young people are suffering from mental ill health right now. Most of them, a good majority of them, don't receive the care, not only the care, but also the support they need to work through these things. And currently there is an underinvestment in mental health. In adolescent health in general, it's a small investment, but also in mental health specifically. And when we talk about mental health, we don't mean just, those who may be having specific mental health conditions, but we're also looking at promoting mental wellness, right? We want to not just not have a mental health illness, but we also want to have, be mentally well and prevent those things from happening. So that's, a summary of the knowledge brief that was produced. I don't know if Kiara's back on. I would be happy to pass it back to her.
Kiara, do we have you back? I think she's not yet back.
No, unfortunately, she's not back.
Okay.
Would just checking if Valentina, Regina are on the line, if they would like, I don't know, to say something, or if not, that's understandable.
Hi, Mimi, that's Regina.
Yes,
I'm
please
online. Probably
Great.
best to wait for Kiara to
Oh,
come
Kiara,
back.
there she is. There she is. Perfect.
Sorry,
Yeah.
I was, I don't know, I was kicked out of the meeting. I mean, these issues are the negative aspect of our Zoom meetings, but happy to be back. Sorry, it took me a while. Yeah,
Kiara, I just did your first slide for you, but I'm happy to pass it back to you from here. Okay.
Thank you, Anna.
Okay.
Yes, so when
It's not an option. Oh, no.
You're just on mute, Kiara.
Okay. Yes. When we talk, great. So when we talk about the the impact of COVID pandemic on mental health in general, we know that it has been huge and is still huge. But we also know, according to the latest surveys and emerging evidence, that the mental health toll is higher among some population particularly, and youth are among the most affected by the current situation. We have data showing an increased risk of suicide, substance use, depression, anxiety, and other mental health risks. Many factors are contributing to the current situation. We have been witnessing school closure, across regions and countries, but also the limited opportunities for social interaction, the distress lived by families, the loss of lives, the uncertainty about the future that young people are reporting about, as well as, an important factor is the economic impact that the current situation is having on families and on young people particularly, being them maybe, even more vulnerable to job losses and impoverishment to a certain extent. Also, if we're talking about the impact of COVID, we need to talk about the impact, even within young people, to certain most vulnerable groups. And within them, explicitly talking about those adolescents that even before the pandemic had already been experiencing some emotional distress and some other symptoms of mental health conditions. For them, the situation is even more difficult. They have been reporting, I think, up to 40% of those that have been interviewed in the UK with mental, of those adolescents with and youth with mental health conditions, reported an increased worsening of their condition during the pandemic. The situation is even, complicated and by the fact that access to services has been impacted by COVID. And I'm referring, to mental health services in primary healthcare facilities and secondary care facilities, but also in schools and workplaces. The very recent WHO survey on the impact of COVID on mental health services has indicated that over 70% of countries reported disruptions in those mental health services for young people. The next slide, please. The next slide, please.
All right, it says my screen is paused. Let me just see what happened. You can't see the next slide?
No, we can't.
Second, let me just stop sharing and do it once more. Okay, how about now?
Yes.
Mimi, you might want to stay out of the slideshow mode because it tends to crash sometimes. Just go into the screen before.
Oh, okay. Let me just.
Yeah, I would stay there. Yeah.
Oh, here. Okay. Can everybody see? Can everybody see this?
Yes, I can see it.
Can see it.
Okay.
Great. So COVID is also an opportunity for strengthening mental health services for now and for the future. the UN Secretary General, along with the heads of other UN agencies, including Dr. Tedros and Henrietta Ford, the Executive Director of UNICEF, have been really advocated for an inclusive approach to response to COVID, with mental health being one of the essential components of that response by countries. I have here in this slide the policy brief, the UN policy brief on COVID-19 and the need for action on mental health that highlight, the importance of of including programming around mental health and strengthening mental health services, but also considering the mental health of the different segments of the population when planning and monitoring the responses to COVID-19. The strong message that we would like to convey is that indeed evidence-based interventions for strengthening the social emotional competencies of young people, for them to be better prepared to cope with adversities, including those that we are currently facing in the current context, are available. There are evidence-based strategies that we can confidently suggest and indicate for countries to implement in their context, and with a wide variety of opportunities for implementation of those interventions across a range of delivery platforms, like in schools, in schools, in communities, and in the healthcare facilities. In this slide, there is the cover page of the WHO guidelines on mental health promotive and preventive interventions, with a very strong recommendation for integration of social emotional learning in the school-based curricula for adolescents. Young people are not only vulnerable and experiencing increased distress at this time, but are also very much active and part of the response by countries to COVID-19. We have many examples from countries, from young people taking an active role in establishing online peer support, to them actually being part of peer-to-peer type of psychosocial support interventions. They have been a strong advocate, and also particularly, in relation to the, as part of the latest World Mental Health Day celebration and events. And I want to highlight an opportunity for more young people to be part of this movement and, for advocating for increased investment on mental health. There is a global challenge that has been launched in the past weeks, where we invite people to show what they do in support of their mental well-being, like dancing, doing art, and other activities, and disseminate those using favorite social media platforms. The next slide, please. There are a range of resources that WHO, UNICEF, the Interagency Standing Committee, and others have made available to support youth mental health. I want to highlight here the illustrated guide, the WHO illustrated guide for coping with distress. It has illustrated illustrated strategies, really, to guide step by step people in managing distress and coping with distress. I highlight also the Q&A on adolescent youth and COVID-19, available on the WHO website, because we know also that misinformation is a source of distress for many. And the next slide, please. And then the last slide, is really, it's really about, very concrete tips that WHO, UNICEF, and other partners, as part of the Interagency Standing Committee effort, Interagency Standing Committee for Mental Health and Psychosocial Support in Emergency, as part of this collective effort, have engaged young people into the development of a few tips that could really guide and help young people implement some simple strategies for better coping with mental distress and taking care of their mental health. Here in this slide, I have the tips for particularly about taking care of yourself, so how young people should take care of yourself. And these tips are complemented by other set of tips that Joanna will introduce. Those are available on the Voices of Youth website. Over to you, Joanna.
Thank you so much, Chiara, for that overview. And you can see Chiara began to share some of those tips on how to better take care of yourself. And for me, whenever Mimi, you get a chance with the slides, I would like to kind of go through one set of the tips with you, or a few of the tips, kind of just to give you a bit more flavor of what the social emotional learning contents of the HAT package are about. And in this set of slides, Chiara showed taking care of yourself. We have taking care of your relationships. We also have how to be a better problem solver. And for this one on taking care of your relationships is the one I'd like to focus on today, because we know that relationships are such a central part of our lives, and that our relationships do have an impact on our mental health. In COVID-19, as Chiara has also mentioned, everyone has felt the effects of confinement and physical distancing, but young people, adolescents and youth in particular, are feeling this. Next slide, please, Mimi. In a number of different surveys and polls, and on our Voices of Youth platform, voicesofyouth.org, we've seen young people expressing that they're feeling frustrated or sad or lonely and isolated. And we know that loneliness and isolation in particular, or that feeling of disconnection from others, does have a negative impact on our mental health, as can also experiencing, conflict in relationships, which might be happening more easily and more often if we're spending a lot of time with the same people at home. And it's particularly tough on adolescents and youth. If you can go to the next slide, Mimi. Because developmentally, adolescents are really just not wired to be in lockdown and to be isolated from their peers. They're at a time where, I think someone else had been mentioning this earlier, they're really trying to form their own sense of identity, which means they might be developing kind of more independence and autonomy from their family and from their parents. They might be looking more towards peers and that connection with peers, which is why friendships at this point of life really matter a lot. It matters a lot to everybody, but particularly in this phase of life. And that's also why confinement and physical distancing really contradicts what adolescents and youth are needing and wanting at this point of their life. But these tips are really about what can we do. I just want to highlight 3 things today that young people can do on a personal level. Mimi, if you don't mind, the next slide. The first one is, for example, we have a different set of activities or recommendations for things that you can do. One of them is 5-minute chats. And 5-minute chats really just means setting aside 5 minutes, setting aside some time, even if it's 5 minutes, to connect and to have conversation with others. This is about making meaningful connections part of your daily life. During this 5 minutes, really the only thing you need to kind of focus on is being present. So that might mean not checking something on your phone or not doing something else, but really trying to connect with the person that you're talking with. And I really loved reading about someone's experience trying these 5-minute chats with their parents during quarantine, where they said they really learned a lot of interesting things. For example, she learned like her father used to ride motorbike when he was young, something that she didn't know about. I also heard from another youth that when he tried this kind of 5-minute chat with his roommate, but for the first time, he heard his roommate talk about how much his relationship with his grandfather meant to him, and how, you know, not seeing him for the last 6 months was really affecting him. And, you know, I think all of us have interactions during the day, you know, whether it's online or in person, where we interact, but we're not really hearing the other person, and we might not be sharing something meaningful about you know, ourselves to them. And I think that is something we can be more intentional about, and making these kinds of meaningful connections in our daily life is what's going to help us combat, you know, these feelings of loneliness and isolation. So that's, for example, one thing. The next, if you can go, Mimi, is, you know, something we talk about, knowing our own feelings. And I think feelings, we think about it as something personal, which it is, but feelings are also, and our emotions are also so central to our relationships, because our emotions impact the way that we interact with one another. You know, I might be yelling because I feel mad, or I might be ignoring someone because I feel hurt or annoyed by them, or, you know, I might be smiling because I feel happy to see them. And I think that being able to recognize our own feelings is the starting point for being able to know how to deal with them, and also how to better react to one another towards building better relationships. And you know, for most of us, you know, for myself included, I think that we have this tendency to suppress, you know, to not want to feel these big emotions, and we don't always have the words to accurately describe how we're feeling. But one simple thing, you know, in these tips that we talk about is just start to list those things and situations in your life that might make you feel joyful or excited or disappointed or frustrated or afraid. And when you begin writing those things down, you become more aware of what situations make you feel a certain way, and what it is that you feel during certain situations. I really like what one youth had also suggested before, that they created kind of a music playlist that helped them when they were going through different situations, just to also be able to work through that mood, whether it was a positive or a negative emotion that they were feeling. And that might be something very practical that could help as well to make it more concrete. And I think that all of these things, the more that we practice, the more it becomes, you know, natural. We become more self-aware, and this is really the goal of some of the social emotional learning learning modules that we have, these tips that we have. And becoming more aware of our feelings and how others around us feel really can help us improve the way that our relationships are. And so the next one, for sake of time, I know we're running a bit over, so I'm not going to really go into it, but you know, connect with people who support you, and also, as Kiara mentioned, how you can be supportive to those around you, to your peers. Feel free, you can read about this more on, if you go to the next site, voicesofyouth.org, and also the WHO site has listed the full set of these tips. And simply, if you feel like connecting, I think Audrey will put it in the chat box. There's a few ways, if you want to have this kind of conversation more, talk about this content more, voicesofyouth.org is one of them. If you're not already registered for UReport, you can receive information through UReport, and also contribute your opinions to certain topics on UReport. And also, lastly, I just want to mention an app that was started by a young person as well. It's called Runaway App. It's a place to connect with peers and also learn more about mental health if you're interested. So, thank you.
Thank Thank you so much to our keynote speakers. That was very informative. Because of the sake of time, I don't think I'll be able to read out some of the questions that were posed to you, our keynote speakers, because we really want to hear what the young people have to say about this. But just to remind everyone that please make use of the chat box to keep on writing the questions that you have, and as well as the social media hashtag Adolescents 2030. So without wasting much of our time, we'll move on to our adolescent speakers. We can start with Omar. If you could tell us in a few words how this whole mental health issues have affected you as well as your peers, and how has COVID-19 really impacted this? Over to you, Omar.
Thank you, Audrey, for giving to me the floor. I would like to say first, thank you and welcome to all colleagues and partners. It's a big pleasure for me to be selected to this live session. And I saw many of my friends and teachers joining us now, so I'm very excited to be speaking in this meaningful event in front of all listeners from all over the world. As Audrey mentioned, my name is Ömer Faruk Sönmez, and I'm an adolescent university student. I study dental medicine and now in my third year of faculty in Izmir, Turkey. I'm currently working in Civil Life Association in the International Relations team, and I'm also a board member for European Dental Students Association. I want to express my happiness again that all of you were very curious about adolescent mental health and joining us today. I really appreciate it, and it's really something precious that you attend this session, and also it's really something big for me to be here speaking about mental health. I believe it's very important to be able to speak about adolescent mental health and well-being in order to put it on the top of our agenda. For me, it's clear that the more we talk about mental health, the closer we are to break down the taboos around mental health and well-being issues. I think this event is one of the greatest chances to bring a valuable influence on the adolescent mental health topic, which remains, in my opinion, a little bit under the carpet so far, and because as we focus more on physical health problems and economic results of the COVID-19 pandemic. Although the COVID-19 crisis is in the first instance a physical health crisis, it has the seeds of a major mental health crisis as well. Psychological distress in populations is widespread. In my opinion, we as adolescents and youth are one of the most affected groups from this kind of emotional difficulties. It's because it's a sensitive period due to the rapid physical, emotional, and social changes in adolescent life. It's obvious that many young people experience mental problems due to the competitive education conditions, difficult upbringing conditions, or family situations, and these problems are increasingly affecting irreversibly the lives of many young people. Now with the COVID, these problems, in my opinion, are triggered more than ever. We are dealing with several mental health issues among adolescents in Turkey, such as loneliness, anomie, eating and sleeping disorders, anxiety, and depression. Those are probably the immediate effects of school closure, social isolation, and family stress. If no action is immediately taken, the results can be more serious and even would end up with long-lasting mental health issues among adolescents in the post-COVID world. So regarding the steps of the required action, I find the presentation from WHO and UNICEF very important and comprehensive in terms of addressing the information needs of adolescents, and as well as providing a solid foundation for taking actions against this in many ways. Now I will try to address our needs as adolescents based on my own story and supporting it with some data from the European Dental Students Association, EDSA, Mental Health Survey. As I'm in the executive committee of EDSA, I hope I will have opportunity to share with you the case in the European level, not only Turkey perspective. One of the quite clear and expected results from this survey is that many peers of mine reported their anxiety and depression being worse than pre-COVID. Reflecting on this, I would say the first time I noticed my depression was when the total lockdowns were implemented. In the first, let's say, the Corona days, I was happy to have a break from my school and quite satisfied to save more time for me and my family. Everything was fine. But then with the total lockdowns, I entirely changed my view and was getting nervous about being subjected to the local and national lockdowns and social isolation, of course. It was difficult to get used to not being able to meet people, do sports, travel, in short, anything I wanted to do. As far as I'm concerned, social isolation caused stress not only on adolescents, but also on the other family members. Actually, this brought mutual intolerance in the family and conflicts, and these resulted with domestic violence increase, unfortunately. If I come to another point of the pandemic, I would of course tell about disrupted education. I want to emphasize that many schools didn't immediately offer online alternative for education. That was another source of the stress of the students. Even after the online educational materials were provided and the system was set up, I was personally still very worried about the quality of education and keeping up with the clinical and the practical skills as a future dentist. Let me share you another survey from the data and survey data to support this. According to the survey, students are reasonably satisfied with the changes to teaching and exams. Maybe that's because they are easier than before, but they remained worried about practical and experience and clinical skills, particularly as they come to the end of their studies. I also observed that uncertainty in the student's life, in the adolescent's life, are triggering the well-being of adolescents. Students would like to be informed earlier on changes to teaching and exams better communication with students. A healthy communication with their teachers would help to reduce the stress level of adolescents. Now I want to draw your attention to a point rather than education and social isolation. Again, according to our survey, a significant minority, roughly 40%, lived with someone at a high risk of COVID complications. Therefore, it's another risk factor, I think, to consider for anxiety. I see myself as an example for this because I had COVID and I was scared, but not of myself, but of my family members who are old and who have chronic diseases. And I was very afraid to infect them and of course other people. Personally speaking, it sounds terrible to have a role in the transmission of the virus and infect people. Taking everything into consideration, I can say we have poor knowledge of mental health services available. It's clear that adolescents could be better informed of services available to them, and I would even suggest making it easy for us to access to those services. Even maybe an online system for mental health services could be provided to the adolescents by the health authorities of countries. Thank you, Audrey, again. That's all I wanted to say.
Thank you so much, Omar. Thank you so much. Talk about evidence-based interventions. Anxiety and depression is so real, and what you experienced, what you had to go through, I really appreciate you sharing all of that with us today. I'm sure everyone is still typing in questions, and I'm sure everyone has got burning questions about how you went through all of that emotionally and mentally, but we will save those questions a bit later, as we would like to hear what Bhumika has to tell us today. So Bhumika, over to you. I hope we have you with us. Bhumika?
Yeah. Okay, at the onset, I would like to thank the organizers for having me in this session.
I would like to start with what I personally understand by the term mental health. So for me, mental health includes psychological, emotional, and social well-being, which I think in turn has an impact on our thought process, actions, and how we relate to different things and the people around us. So in my opinion, youth and adolescents are considered to be constituting a healthy age group. And this might be one of the reasons why inadequate attention is being given towards their health needs. And if we talk about mental health, it further goes on deep prioritized. And this is mainly because there is less awareness regarding mental health in countries. If I talk about my country, then especially it's there. So COVID-19 had significant impact on me and my peers. So I had just completed my grade 10th exams when a national lockdown was imposed in India to check the transmission of COVID-19. So at that time, I and my friends were all anxious and stressed regarding whether our exams would be evaluated properly, when would we expect our results, and what would be the admission procedure for the next class. Moreover, from then on, we stopped purchasing newspapers, and we were very cautious while bringing anything from outside to our home, be it for basic commodities too, be it vegetables or fruits. So another thing that I'll like to reflect upon is that, like, although we didn't get the results of grade 10th exams, but yes, we had a tentative admission to the next class. So what we like, it was like a big transition for me and my friends to be promoted to high school from middle school, and we needed guidance from our teachers. But what happened was, due to the sudden lockdown, we had a sudden disruption in our studies. It took us time for about 2 to 3 months to like adapt to the online platforms, and it wasn't easy either for the teachers or the students to suddenly like change the mode of instruction. That it was a sudden like change, sudden shift from offline education mode to online education. It took time for also searching for like appropriate platforms for us, which were appropriate for us. So I had also talked to a number of students of my age belonging to different sections of the society from my part of the country. So from the inputs and the feedback that I got through them, like helped me realize that there are many more problems which are being faced by students, both positive and negative. So if I talk with respect to education, then I feel that the opportunities for learning online have increased. So there are webinars being organized by various institutions and organizations. And we are seeing that many quiz and other such activities are being like taken up by the government to make students and adolescents more aware of certain issues of national concern. But at the same time, a prolonged exposure to screen, I think, is affecting my vision. And I have frequent severe headaches due to which at times I'm not able to do my work and I have to take rest. I'm seeing that other students are also facing problems like internet addiction, disturbed sleep patterns, and other such things. They're not like the attention span on online media, on the online platforms are not that much, and we're not able to concentrate on our studies through these platforms. Even though now the Indian government has said to reopen schools in a couple of days, but the conditions still are not favorable for us to be able to attend schools. And even if we think the schools would reopen, they won't be the same as they used to be before the before the COVID situation. If I talk about recreational activities, then the outdoor activities and if I talk about tourism, recreational activities, cultural tourism, these all are restricted. If I take my example, then before COVID, I was engaged in NCC and swimming, but due to the like sudden lockdown, I didn't have access to any of these facilities, be it swimming pools or drill grounds. So yeah, I was like totally restricted from going outside, and there was minimal outdoor engagement. Uh, at this time, I think students are taking up to get engaged more in individual games, which is affecting their development in terms that they're not developing skills like comradeship and all, and they're also like engaging more in video games and all. If I talk about socializing, as Joanna said, at this time of our life, being adolescents, we love to be with our friends and peers. So there are social networking sites and platforms like WhatsApp and all, where we can interact and be in touch with our peers. But still, at the same time, we are at risk of being victims of child abuse through cybercrime. And also like the interactions that we had with our teachers and friends being in school were a lot more different. Like as if I compare them being in the online mode. Like if I talk about myself, I've not been into contact. I've not met my friends personally for over 7 months now. And yeah, we enjoyed being together and we had lovely memories. We used to make memories and we used to have fun in school. Now if I talk about, like, we have more time for ourselves now in the lockdown. Like we can spend time honing up the skills of and definitely like engaging time in our hobbies and all. We are spending quality time with our family, but at the same time, there are families which are facing economic disparities. And due to being home all the time, there are situations wherein parents and the family members are building in like emotions like frustration, irritability, and boredom. And this all is affecting the child's mental health. I am in contact with a couple of friends who are from humble backgrounds, and they are facing economic disparity among the families. And due to that, like all that thing is affecting their mental health. There are also cases wherein some students in India have committed suicide due to not being able to access the educational resources, or because the other resources are not available in nearby there where they live, their place of residence. So I think if I talk about in a general perspective, then COVID has impacted our like mental health as well as our lives in both positive and negative ways. Thank you.
Thank you so much, Baumika, for that wonderful speech. And it's so true that the first misconception that exists is that most people just think that young people are a healthy bunch. And this is the reason why our mental health is never or rarely even prioritized. And from what I got from your speech is that most young people are faced with anxiety. The vision is now being affected, mental exhaustion, internet addiction. I mean, it's just too much for a young person to be trying to deal with, apart from being isolated from your loved ones, not being able to go to school or even do your usual recreational activities. And also the most heart-aching one is that young people and adolescents may or already have become victims of child abuse through cybercrime. Once again, thank you so much for that. And there are a lot of comments that are coming through into the chat box. Please feel free to refer to it and to even put the questions that you have. And don't forget to go on your social media sites with the hashtag Adolescents2030. Now I've got a question that was posed. I'm sure our representatives from WHO or UNICEF can take this up. It's saying, how can we prepare now to ensure that we have the capacity to meet the volumes and types of emerging child and youth mental health needs, both through and post-pandemic? I'm sure Kiara or Joanna can take that up. Over to you guys.
Yes, thank you for this important question. I think, it is really, the time now, to make sure that we go loud, with advocacy and make sure that there is the right type of investment starting from now, and taking opportunity of the increased awareness on the needs of young people, for taking care of their mental health. So I would say, please, do join any opportunity for speaking up about the need for youth mental health. Take part as much as you can, in any, strategy and activity on the ground to support mental health for young people. I think, the key word is really, mainstreaming youth mental health, exploiting any opportunity we have to establish mental health promotion, prevention, and to strengthen the services for those young people that experience mental health condition. For me, one key priority would be schools. And, we can think of different strategies there, face-to-face type of activities, and but also digital opportunities. And as well, and talking about the digital opportunity, the second probably, biggest chance we have is exploiting the online platforms for, reaching as many young people as possible, with, the advantage of having evidence-based, having all these tips available that are really, grounded on good evidence on how, we can really improve the way we cope with adversities, as well as making sure that, we promote the messaging around when you should recognize that is the time to consult services. Over to Joanna for any additional thoughts.
No, that's excellent. I agree with everything that Chiara said, and I think you're right. The volume and the needs are greater than perhaps the number of professionals that are available to respond. But at the same time, I Chiara and myself, we've seen that, young people themselves are one of the best resources you have for each other and the biggest assets we had in some of these, and so as part of the materials we're looking at, what we can do to train and support peers to be there for one another. Also, Chiara mentioned, especially through schools. So I think that is something you can all look out for. And I know that there are existing programs and ways for you to engage in that way, even if it's just promoting some of these practices and behaviors on a small level. Certainly, there's a range of things that need to happen from policy to program, but I do think that young people have themselves led the way very much and are contributing a lot into shaping what that capacity building means. So we really appreciate your continued engagement and your continued contributions as we tackle these things.
Thank you so much. Thank you so much, Chiara and Joanna, for those responses to our questions. As young people, we should start thinking around what we can do to ensure that we promote the mental well-being of our peers. So if you have an intervention or something that you think of, you can just simply type it in our chat box or even take it to our social media sites. Don't forget to use the hashtag adolescents2030. Now I've received a question for Omar, which says, as an adolescent yourself who contracted COVID-19, what additional measures must be taken to ensure that this population is prioritized in response, both in terms of COVID-19 prevention and mental health support? Over to you, Omar.
Thank you, Audrey, again for your question. With the answer for with this question, I also saw some questions in the chat box, so I'll try to include them as well. Even though I'm not directly in the risk group of COVID-19 as an adolescent, I was so much affected mentally. As I mentioned before, along with the concerns regarding transmitting the virus to the vulnerable ones, I was feeling insecure about my own health, because the reason was to have the possibility to have an underlying condition that maybe I wasn't aware of before. Another source of my mental stress in this COVID positive period was that I had relatively stronger symptoms than my peers. I was worried when I had, for example, difficulty in breathing, because in the media, in the society, there is a thought that have been imposed, like that the adolescents must undergo COVID-19 without any symptoms, or they must have COVID-19 without any symptoms. So that was something stressful for me. So I think adolescents should be more informed about COVID-19 and how the infection can affect them in different conditions. Another point related to adolescents and their well-being is that the adolescents that are living with older people or people with underlying conditions, they feel so much of pressure to do any daily task. I think that is not also easy for them, and also something affecting them mentally. I'm not totally sure that we have mental health services available for those adolescents that I mentioned, but because in Turkey, in schools, we often have a psychological counselor that we can go and advise whenever we need it. But as we don't go to school now, we have no chance to get this support I believe we need to have some more available services online or distanced. It would help a lot, and I see that the students are asking for it. So another question that I saw in the chat box from, let me check, yes, from Bisheng Paksoy is that what would you particularly suggest us to adolescents and young people to protect our mental health, especially during COVID-19 crisis and lockdowns? Actually, I can say personally, I can talk about from my experiences. Like I'm trying to get enough sleep and rest enough. I'm eating healthy. I am indulging in physical activity. I'm trying to avoid tobacco or alcohol products. And another thing that one of my friends suggested is, and I tried, is keeping a stress diary. I'm noting down the date, time, and place for each stressful episode of my life. And I'm noting down what I was doing, who I was with, how I felt about how I felt about it physically and emotionally. So this enabled me to avoid stressful situations in the future and develop a better coping mechanism. So I can maybe suggest this stress diary from my own experiences. Thank you, Adri. It's all what I say.
Thank you so much, Omar, for that response and for additional tips to the ones that we already had. For those that had missed some of the tips that we got tips such as you should be kind to yourself, listen to your body, and stay connected to your loved ones. Also have 5-minute chats with your loved ones. You should know your feelings. And the moment you know your feelings, you'll be able to know how to deal with your feelings. And once you know how to deal with your feelings, you will know how to react in certain situations. And lastly, you should learn to connect with people that support you the most. Now moving on to Bhumika, I have a question for you, which says India has its largest ever adolescent and youth population. It will continue to have one of the youngest populations in the world until 2030. What measures can be put in place to ensure that young voices are heard and that India can capitalize on the wealth of its young population? Over to you, Bhumika.
Thank you for the question, Audrey. What I feel is that we as young boys and girls in India are very talented and have the potential to transform India and also bring positive changes in and around us. So there are organizations in India like NCC, National Cadet Corps, NSS, National Service Scheme, and NYKS, Nehru Yuva Kendra Sangathan, and many more, which do engage us like being adolescents and teenagers in constructive activities and instill in us and help us in overwhelming the values like of selfless service towards our people and our country as a whole. But I think these organizations as a whole are not the appropriate places where we as adolescents can raise our own concerns. So I think the government should take it as a responsibility to take our views and opinions while they're drafting a certain policy which is applicable to us. So it should be like nothing about us without us, and because we are eventually the stakeholders. So we should be given and we should have the rights equally as any other adult. So we should be given that right to be able to express our opinions, and because eventually that policy would be for us. We know better how like what are the benefits of it and what are the improvements that we as adolescents want in it, like what are the problems being faced by us. Moreover, I think that if I talk about in schools, so there are no organizations like journal clubs or something in our curriculums in our schools, wherein students are engaged in analyzing the policies which have been made and which have been drafted for us. So even if there are any organizations or there are any opportunities for engaging like this, we as students are generally not aware of it. So I think the government should be like working towards more making students and youth aware of it. It can be done by certain ways, by like carrying out certain awareness drives or by holding on certain counseling sessions or anything like that. So we also have PMNCH advocacy toolkit. So which has been implemented in India through the YP Foundation. So such initiatives and such toolkits can be like scaled up, and the government can help in promoting it further and making students aware of the opportunities available. I also think that in India, the policies framed for students are framed and drafted keeping in mind that all students are alike, but it's not like that. Students in India belong from different backgrounds. They belong from different backgrounds. They are from different cultures and traditions. All those things affect upon how, like, what are the requirements and all. So if we'll engage more of youth into the drafting of policies, taking their opinions and views, that might help in using the wealth of the country and like using that human resource and utilizing upon it. Thank you.
Thank you so much, Bhaumika, for that response. It was very insightful. From your response, I got that maybe as young people, or even as advocates, or even during advocacy, we should be able to utilize the PMNCH advocacy toolkit in everything that we do. And there should be awareness raising by the government, which is incorporated into the school curriculum to ensure that everyone has a holistic psychosocial support. And as young people, and even as people within the community, we should try to do acts of service, selfless service to other people, as this will also increase the way that we feel mentally and emotionally. Thank you so much to all of our speakers. I really appreciate your speeches as well as the responses. There's a hype conversation happening in the chat box. Please join in the conversation, and there are also links that were sent in there that you can also refer to that have most of the toolkits as well as the books and other links for you to read around adolescent mental health. At this juncture, I will ask our WHO representative to present resources and key messages for action. I think Kiara will take this up. Kiara?
Yes, thank you. I think, a lot has been said already, with all the panelists contributing to this conversation. Thank you for this opportunity to really, provide a recap. I would like, to highlight how, the young people are really, key players in taking action for taking care of young people's mental health, especially at the time of the COVID-19 pandemic. We have posted in the chat a few links to the resources that are being made available. I would like really, to highlight the tips available on the Voices of Youth website. Those were, produced, again, with active contribution of young people. But it's not only, the burden of young people themselves of taking care of their mental health. So, we should ensure that there are environments that really, provide the support required for young people to feel the support and to enjoy good and positive relationships, whether in the homes or the family and the schools and the communities. There are resources for families on parenting for young people, available on the WHO website. Sorry, you don't see the slide, but I will copy this additional link into the chat box, in chat conversation right now. And there are additional resources for care providers in schools as well as in health facilities. So I will, now just insert those links in the chat. But the key message is, this is a huge invisible problem that has been under recognized and not addressed, and it requires a really collective action from advocacy, but really also, in terms of implementation and in terms of making sure that we document whatever is being done and the impact of those actions, for young people, families, and communities broadly. And maybe that's the last word. There was a question, a very important question around why it is important to focus on adolescent mental health. I think, mental health is part of health. But we're not only talking about health of adolescents here. We're talking about the health of adults. We know that behaviors, really, many behaviors, are acquired during adolescence. We know that the brain maturation and growth during adolescence is huge, and we know that educational opportunities and occupational opportunities are really very much related to how we live and we cope with adversities, during that particular time that is, adolescence and when we are young adults. So it's really beyond health. We should be able maybe, to better document, how mental health is impacting a whole range of issues, beyond health and mental health outcomes. Thanks for this.
Thank you so much. And thank you so much, Chiara, for that response and for those pointers. Unfortunately, we are running out of time, but this segment of our session, we're going to be asking you as young people, which topic you would like us to discuss on the next live series on adolescent health and well-being in times of COVID-19. You know what they say? Nothing is for us without us. So I will have a poll that is flighted in the chat box so that you can select the topic that you would want. Which topic would you like featured in the next live session? So this is a multiple choice question. So if you could just select from the 8 topics that are there. We don't have much time. So as young people, we know that we're always quick on our fingers. If we could get going, we've got less than a minute. We choose what we want, and that is what we will do. We've got increasing domestic and intimate partner violence. How can I protect myself or help my peers? What can I do to support schools in ensuring that no one falls behind because of COVID-19? Protecting yourself from online risks. What does safe sex mean in times of COVID? Will COVID-19 affect job markets and employment prospects for youth? How can I stay physically active in times of COVID-19? How do I eat healthy in times of COVID-19? And protecting yourself from tobacco, alcohol, and drug abuse in times of COVID-19. I've just submitted my response. Young people, where are you? Please submit your responses in 5, 4, 3, 2, 1. Okay. I'm sure everyone has typed in the question, the topic that they would want to be discussed on the next live series. If we could have the results posted again so that we can announce it. Drum roll, please. Yes, so the topic that we'll be discussing will be increasing domestic and intimate partner violence. How can I protect myself or help my peers? So that will be the next topic for our live series. So this marks the end of our discussion. Thank you so much for everyone who took time to be with us today. I'm not sure if we still have maybe just in 5 words, just 5 words. Bhumika, can you just tell us how you feel about all of this, and what future do you see that should be held for young people in terms of mental health? And soon after Bhumika, Omar, you can just tell us in 5 words because we've really run out of time. Over to you, Bhumika.
For me, it was a wonderful session being with all of you and interacting. I learned a lot of things, especially the coping strategies for stress given by John and Chiara. And I would surely discuss it with my friends and peers. So yeah, thank you.
Thank you so much, Bhumika. Omar, in 30 seconds.
Thank you, Audrey, for moderating. Okay, thank you, Audrey, for moderating this event. And thank you, Mimi, Sharaf, Anas, the background heroes. Thank you, Joanna and Chiara for their keynotes. And thank all the participants who are interested in this mental health. And I'm really proud to be here speaking. And I really appreciate everybody was so curious about mental health issues among adolescents, and they came and attend our session. Just big thanks from heart.
Thank you so much. Thank you so much, Amar. And thank you so much, World Health Organization, PMNCH, for giving us young people this platform for us to be discussing mental health in terms of COVID-19. Thank you so much to all of our speakers, Joanna and Kiara, Omar and Bharmika. Thank you so much. I hope that we'll take care of each other and ourselves. Be kind to yourself. Make sure you go back to the chat box. You'll find a lot of useful links for you to have a good read on. Thank you so much. I'm Audrey Chaveka once again from Youth Engage Zimbabwe. Thank you. Until next time.